Hey guys, do you know where the pain from knee osteoarthritis comes from? Well, today in Basically Physio Presents Knee OA Sources of Pain, we are going to find out. So what exactly is knee OA? Knee OA is when there is a progressive loss of articular cartilage within the knee joint, and it is known as a degenerative joint disease. So just a quick recap, the knee joint is made up of two joints, which is the tibiofemoral and the patellofemoral joint. So taking a look at the x-rays of a normal knee joint and an OA knee joint, on the left side you can see a tibiofemoral joint, how it looks like, and on the right side you can see a patellofemoral joint, how it looks like from a normal and an OA point of view. So the main thing that you want to look out for is the reduce in the joint spaces. Coming to the sources of pain, previously in knee OA it was thought that the pain is coming only because of the wear and tear of the cartilage. However, in the recent decade it is found out that there is actually inflammation happening within the entire joint itself, and there's also an element of peripheral and central sensitization which causes the pain to be more enhanced. So to keep things simple, we'll be looking at two main pain sources, and first thing is the subchondral bone sclerosis, and the next thing is the inflammation of the synovium. Coming to subchondral bone sclerosis, what exactly is the subchondral bone? It is the bone that lies directly under the cartilages as shown in the image here. How exactly is the subchondral bone sclerosis coming about? So there may come a time where there are catabolic factors that are produced inside the joint which will start to degrade the cartilages, and this causes the load absorption in the joint to be affected due to the cartilage degradation. The load from the joint now triggers the bones inside the joint, especially the subchondral bone, to compensate by thickening, hardening and forming bony osteophytes along the edges. And this changes actually causes the joint spaces to narrow and reduce. So in conclusion, the changes to the subchondral bones are one of the source of the pain. The sclerosis refers to the thickening, hardening and forming of bony osteophytes. Also, do consider to like and subscribe to this channel. Moving on to the second factor, which is the inflammation of the synovium. As our knee is a synovial joint, it has both the synovial membrane and the synovial fluid inside it. The synovial membrane lines the joint together with the cartilages, and it lines the inner surface of the joint capsule, forming an integrated joint. The synovial fluid lubricates and provides nourishment as well as removing of the waste products within the joint itself. The inflammation of the synovium begins when there is a breakdown or degradation of the cartilage, whereby some of the products are released within the synovium. This then causes the synovial cells to be activated, which then produces more catabolic products which degrade the cartilage further. This creates a looping vicious cycle whereby there will be further degradation due to the products of the activated synovial cells, and this will also cause an increase in the synovial inflammation. So to sum it all up, the hyaline cartilage in the joint is not innervated by any nerves, so the pain cannot be coming from there. Where the pain is coming from is from the synovium and the subchondral bone, because these are the innervated structures. Additionally, there is an element of central and peripheral nerve sensitization, and this can actually be enhancing the pain.